A very good afternoon, everyone. This is Arpita Jain here with you. We welcome you to another live session, a very important webinar on Prime Health page. Thank you, everyone, to everyone for joining us. We are live from YouTube channel, which is Prime, and from Prime Health. An important topic today. Talking about skin cancer awareness as we are into the month of May, which represents skin cancer awareness. And, we are going to talk about special insights on how to keep your skin healthy. And we have specialist dermatologist, Dr. Arpita Jain. She's currently practicing in Prime Medical Center, Burjaman, with an extensive experience of 12 years, out of which she has been working in UAE for the last 5 years. Doctor, thank you very much for joining us today. You're welcome.
Thank you.
Doctor, it's a very important topic today, talking about skin cancer. A lot of people are not aware of skin cancer awareness. Some might take it into a different disease, or some people may ignore it, though it's a very, very important organ of the body, which is actually shown to everyone. So we are going to talk about skin cancer today in detail. Dr. Arpita is going to give an initial talk on skin cancer awareness, and after that, we will be taking your live questions through the comment section, and we have some questions that have come pre-session, and we are going to ask those questions to Dr. Arpita. If you have any question, please feel free to ask Dr. Arpita in the comments, and she is going to answer you. Doctor, without wasting further time, I would really like you to please give us this talk on skin cancer awareness. Thank you.
Thank you, Mr. Fahad. So thank you all of you for logging in and lending us your ear. Today I'm here to talk a basic, but a brief idea about how a skin cancer look, how can you prevent it, and what kind of people are more prone to get these kind of cancers. So I'll be talking in a brief way, but I'll give you most of the knowledge which is needed to easily identify this at home and seek our help when needed. So to begin with, skin cancers. Skin cancers are basically divided into two major types. One is called melanoma, which arises from a mole, and the other is a non-melanoma skin cancer, which has no relation to the existing mole. So these are the two basic categories of skin cancers, melanoma and non-melanoma. The non-melanoma cancers, which does not arise from the mole, are supposed to be better in the sense that it does not spread too much. They are not very lethal. They are not very notorious in causing too much of complications. But melanomas, on the other hand, are called deadly skin cancers because it can spread very fast. It is not only localized to the skin, but if left unidentified or if left untreated, can really spread to other organs and bones also. So melanomas, which is a more serious or a more deadly kind of skin cancers, are more easy to see at home or identify at home, which can help you come to us and seek our help if need be. Now, to know how a melanoma or a non-melanoma looks like, the melanoma which arises from the mole, what you need to see for the mole or how it looks or how you could raise a suspicion that it could be a melanoma is by what we say is an ABCDE sign, in which all A, B, C, D, and E stands for a particular property of the mole, which when you notice, you should come to us and just get it checked if it is getting into the cancerous stage or not. So to start with that, A stands for asymmetry, which means that if any of your mole does not look symmetrical, symmetrical means that the two halves of the mole should be similar to look at. So if you feel any of your moles are not symmetrical or they are asymmetrical, then that should raise a suspicion. B stands for borders. Border means usually when you see a mole, it usually have a very well-defined round borders, a very circular one. But sometimes if the border is not very well defined, or it is zigzag kind, or it has finger-like projections, that is not a good sign. So any of the mole which has an irregular border needs to be checked. C stands for color. Color means that if one mole has two or three different colors together in the same mole, is not always considered a good sign. So whenever a mole comes with a mix of colors, you should seek our help again. D stands for diameter. Diameter means whenever a mole is bigger than 6 mm, or to make it simpler, if we have seen the eraser at the end of the pencil, the diameter of that eraser, if the mole is bigger than that eraser size, you should come to us. And finally, E means evolving mole, which means that if the mole is changing, like it becomes bigger in size, it becomes smaller in size, it becomes itchy, oozy, painful. So any kind of change in any existing mole is not supposed to be good. You should get it checked. Sometimes it could be general irritation on the mole or something like that, which is simple and benign. But sometimes these changes could be an early sign of a mole turning into a cancer or a melanoma. So just to revise once again, the ABCDE sign for detecting early melanoma. A is asymmetry, B is for irregular borders, C is for colors, D is for diameter, and E stands for evolution of a mole. Apart from the ABCDE sign, the other way in which you can get to know whether a mole is not okay for you is called an ugly duckling sign, in which if a particular mole stands out different from all the other moles which you have on a body, then you should get that mole checked. Let's say you have all multiple moles, but they are smaller, they are brown in color, and they look almost same everywhere. But then you have one mole which is more darker in color or more bigger in size, which looks different than all the other moles. It should be checked. So this is about the cancers which can arise from a mole, which is called melanoma. The other set of cancer is those kind of skin cancer which does not arise from a mole. It can arise from a normal looking skin. So how do we get to know about these non-melanoma skin cancers? The simplest way to know that is if you have any kind of skin rash, any kind of ulcers, any kind of pinkish or reddish discoloration on the body, which is either not getting better with any kind of treatment, like let's say it gets better but comes back again, it is not responding to treatment and it is just staying on your body for a long time, it should be checked to rule out cancers. Otherwise, sometimes you might have a small patches of area on your body which is like has a rough feeling on it, or it has small tiny scales on it, especially with a pinkish background. That should again raise a suspicion of cancer. These are mostly seen in the area which is more exposed to sun, like your face, your upper body, your neck, your ears, even your scalp. But that's not the general rule. Sometimes it can affect your sun exposed area, but many a times it can also affect your sun covered areas like your trunk and your thighs also. But if any of the rashes which you have is not healing well, or looks different, or looks like a persistent rash, just not increasing but not decreasing also, you should come and get it checked with us. It could be a sign of a cancer. But on the other hand, if you have red rashes or itchy rashes, which is there all over the body or occupying huge body surface area, then that's generally not a skin cancer. Skin cancer usually will be like a small one or two, or very few in numbers, not too many in numbers. So now we know basically how to identify or how to raise a suspicion, a doubt, whether we have a skin cancer or not, and when you should come to us to get it checked. Now, the second thing is who can get the skin cancer? I'm an Indian and I've spent my first 3 decades in India. And to my surprise, people in India, especially, we people in Southeast Asian countries, we assume that skin cancer is only something which will affect people with white skin, and the Asian skin or dark skin are, free from skin cancers. But that's not the rule. It is true that people with white skin, they are more prone to develop these kind of cancer, especially the melanoma cancer, which is from the mole. People who have very fair skin or who have hazel or brown eyes or who have blonde hair, they are more prone to develop melanomas or the skin cancer arising from the moles. But even Asians or the darker skin people, even we are prone to get melanomas or other kind of skin cancer. And the problem with us or the dark skinned people are that because we try to ignore them or we don't suspect it, we usually go to the doctor in a very late stage when it becomes difficult for a doctor to treat us for the skin cancers also. So please keep it in mind that the skin cancer could affect both white skin and dark skin people. White skin are more prone, but even in dark skin people, cancers are present. Second thing is people who have many moles on their body. So the more the number of moles you have on the body, higher is the risk for you to develop a skin cancer. If you have a family person who has a history of any kind of skin cancer, you are more prone or you have a high tendency to get the skin cancer. If you get sunburnt very easily, like you go out in sun and not tanning but sunburn, people who get burnt in the sun with the reddish skin or which exfoliates and which burns in the sun are more prone to develop skin cancers. Apart from that, sometimes people who have very low immune system, like people with HIV or people who are having organ transplant, they have low immune system and they are having a high risk of developing a skin cancer. So generally, in a nutshell, if you have many moles in your body, if you have a family person who has a history of cancers, or if you're out in the sun for very, very long time, because sun is one major reason why we can develop skin cancer. So if you are working outdoors, your exposure in sun is too much, or even as a child, even out in sun for very long time, it can increase your risk of getting a skin cancer. So anybody who has have an outdoor activities or more out in sun, please be careful about the sun because it will increase your risk of getting a skin cancer. And finally, how you can prevent the skin cancer. So first of all, the thing is, if you have any doubts, if you see any mole on your body or any particular skin rash on your body, which is not getting better, the first step of prevention is to seek a medical advice. We will do some tests. We will use a special equipment to check your skin. We can even do a small biopsy to test it so that we are firmly sure that you are having or not having a skin cancer. So early visit to the doctor is the best prevention which you can do. The second thing is sun protection. Sun protection is generally never given that much of an importance because we think that sun is good for us and it will not damage our body. But sun is the biggest enemy of our skin. It one increases our risk of skin cancer many-fold. Second, it will also make your skin age very soon. So yes, if you want to look healthy and younger, you should also avoid sun because it will delay aging for you. Sun protection does not only mean sunscreen. Many times we feel that, oh, sun protection, I should wear sunscreen and then I should go out. But sunscreens are generally not totally or 100% effective in giving you complete sun protection. So generally the advice which we give you for protection from sun is that avoid midday sun, like at least in Dubai, avoid the sun from after around 9 o'clock till around 4 or 5 p.m. in the evening, because that time the sun is at its peak and it will damage the skin too much. So first thing, avoid sun in the midday if possible. If possible. Second, try and be in shade if you're outside in the sun. So let's say you're on a beach or you're having a picnic somewhere outside. Try and seek shade because being in the sun completely increases your risk of exposure to the cancer-producing rays of the sun. Third thing is always wear a wide, broad-rimmed hat, which is like, a bit extended in the front so that it can cover your face and also on the back to cover your back. Plus, try and always wear full sleeve clothing, even when you're out in the hot summer in Dubai, because clothing gives you really good protection from the sun. Even sunglasses are really needed to avoid the damaging rays of the sun from entering your eyes. And lastly, about the sunscreen. Sunscreen, true, gives huge protection against the sun, but only if used properly. Usually, I have seen that what people do is we apply this much of a sunscreen for the full face and we think we are protected. We go out in sun uninhibited, thinking that we are completely protected from the sun, but it unknowingly we are damaging our skin too much because this much sunscreen will never give us a protection which we desire. So sunscreen application should be followed by certain rules and steps. First rule is that always apply a sunscreen at least 20 minutes before stepping out in the sun, because the sunscreen usually takes around 15 to 20 minutes to get absorbed in the skin, and then its action kicks in. So it should not be applied when you are in the car already, but it should be applied when you are about to leave your house around 20 minutes before. Use sunscreen every 2 or 3 hours if you are continuously out in the sun. And the third and the most important thing is the amount of sunscreen. So let's say for the face, if you need to protect your face and the neck, then the sunscreen equal to a 1 dirham coin size amount, or equal to the length of your fingertip from here till here. This much sunscreen is needed to give you a good protection for the whole face and the neck area. So please do not put sunscreen which is very tiny in amount. It will not give you any protection. Put a good amount of sunscreen, and always put some cap and covered clothing to give you additional benefits. How to choose a sunscreen, which is normally asked by me, is that you can go for any brands you wish to, no worries about that. But just read a few things on the sunscreen bottle. First, it should say that it is a broad spectrum sunscreen, which means it can give you protection from both UVA and UVB rays. Second, an SPF above 30 is generally needed and good for a good protection. You need not buy SPF 100. Anything above 30 should be good for you. And lastly, if the sunscreen says water resistant or water like water protective, it means that even if you will sweat, or even if you will be out in the sun for longer time, it will at least give you more protection than the usual sunscreen. So read for these three parameters on a bottle. It should be wide spectrum, which means UVA and UVB both, should be above SPF 30, and if possible should be water resistant. If you follow these rules about sun protection, it will really give you an immense protection from skin aging also, and will protect you from skin cancers also. But whenever you have a doubt about whether a rash could be a skin cancer or not, please do visit us, because if you come to us early, we can help you completely. Skin cancer is highly curable. If you present at a very early stage, it can completely be cured without much of an hassle.
Thank you so very much, Dr. Arpita. That was a very well explained, detailed information on skin cancer awareness in the beginning. I believe a lot of questions are already answered by yours from your end. I've got some questions here that has come. One of the questions says, Doctor, what's the purpose of acne and how to avoid them?
I am supposed the purpose of acne?
Yeah, this is the question. What's the purpose of acne? If maybe the question is
What's the reason for acne?
could be yeah,
Maybe,
could be the reason.
yeah.
What's the
Okay.
reason for acne? Yeah.
Okay, so acne, or what we normally say as a pimple, as a non-medical term, could have many reasons, to be very honest with you. The first and foremost reason is if you have an oily skin, especially in the teenage years when the hormone changes and the skin gets more oilier. So people with oily skin are more prone to get acne. People who have any hormonal imbalances, in terms that sometimes we have conditions like polycystic ovary, which is called PCOS or PCOD. Any kind of hormonal imbalance can also increase the oiliness of your skin, which can lead to acne. But most importantly, maybe a wrong choice of products which applied on the skin for a long time, especially if the products are very oily and greasy, can also cause acne.
Thank you very much, Doctor. Doctor, another question from Dr. Arpita Jain is asking, as an interventional cardiologist, how can I monitor the development of any skin cancer due to radiation exposure in cath lab?
Again, the signs and activities are the same. We should always ask the patient to keep an eye about all the moles which he already has on a body, to examine all his mole regularly, at least once every month, to look for any kind of change which I already mentioned in terms of size, shape, asymmetry, color, or any kind of itching or redness. Or also, if he has felt, he or she has seen any new mole arising after the intervention or after the radiation, any new mole should always be sent to the dermatologist for evaluation, because new moles carry the higher risk of turning into a cancer. But the most important thing is that they should always be aware of their moles. They should always be checking their moles regularly, and any change should be notified to the dermatologist. Apart from mole, any kind of red patches on the skin which is persistent, not getting better, but not itchy also, should also be evaluated, especially if it has arisen after the exposure of radiation in the cath lab.
Right. Thank you, doctor. I've got another question here. Doctor, Ms. Sanita is asking, what ointment would you recommend for second-degree burns?
Second degree burns, generally we would ask you to come to us because we need to see if it is what degree, if it is already in an infection mode or whether it is still non-infective. And generally at home you can start with simple remedies like Mebo ointment. Do not put ice on the burn. Do not cover it with very warm blanket or stuff like that. Let it be washed with a normal room temperature water. You can put Mebo cream from the pharmacy as soon as you get a burn, but then you should visit a doctor who can prescribe you some antibiotics creams or some healing cream which could prevent the scarring and help in faster healing of the burns.
Thank you so much, doctor. Ms. Loisa is asking, when is mole removal advisable?
Okay, mole removal can be done for two reasons. One reason is if a doctor suspects that it could be cancerous or it could have sign of a pre-cancer, which means that it can turn cancerous in the future. So if we come across any of these mole, we do ask you to get them removed. The second reason why mole can be removed is for the cosmetic or the beauty reasons. If you don't like a mole on your body or you don't feel pretty with the mole on your body, yes, it can be removed also.
Doctor, moving towards the next question, Mr. Adil Rizwan has asked a question. My wife's skin becomes very dry and pigment due to liver disease, PBC, I believe. Is there any treatment to regain the skin?
Yes, we can help you, but for that we need to see the skin first, how bad the damage has been done. Dryness might not always be because of the liver issue, same with the pigmentation also. Liver issue could be a contributing factor to that, but sometimes the lifestyle also adds to it. Like let's say if you take shower with very hot water, or if you use very harsher soaps, or if you are very lazy in putting some moisturizers on the body, even those simple things can lead to a dry skin. Dry skin can be itchy, and at times too much of itching or scratches on the skin can also lead to pigmentation. So we need to evaluate your wife fully. We need to see what part of it is because of liver and what part of it is something which is because of lifestyle, which can be easily reversed back. The thing with the liver is that if we find that whatever part is because of the liver issues, once we can fix your liver and make things better, it can be reversed, and it maybe your wife can have the skin which she has had before the liver illnesses.
All right. Thank you very much, doctor. Another question from Simi Prasan. Almost every time I step out to sun, I get sunburn, even after I apply sunscreen. And it takes a really long time to completely get cured. How can I prevent it or fasten the cure?
uh, this I'll again revise all these things with you, that sometimes the amount of sunscreen which we put and we assume that we are protected is not sufficient. That's why please try putting more amount, like I told you, at least one full finger length for the full face. Let's say you want to cover your neck and your back also, then you should put the cream equal to the two fingertips, should be covering your face, neck and the upper back. Second, always try to be covered when you're out in the sun, especially if you have a history of getting bad sunburns. Try and wear loosely knitted but dark colored clothes because it gives you good protection from the sun. Try and wear some cap because caps will also give you good protection, or you can carry an umbrella also. And avoid midday sun between 9 a.m. to 5 p.m. because that is very harsh on your body. If despite doing all these things, despite using a really good amount, SPF 30 and above, and taking sun protection in terms of clothing, you still get sunburn, then maybe you should come to us and we'll have to evaluate your skin, and then we can give you appropriate treatment also.
Great, thank you so very much, doctor. I've got some questions, as I mentioned earlier, that came pre-sessions. A lot of members of our Prime Health have asked questions. I'll ask you one of the questions, doctor. Can tanning and tattoos cause skin cancer?
Tattooing, no. Tattooing cannot cause skin cancer. Tattooing can increase the risk of infection if the place you do it is not well cleaned and hygienic, or if the needle is not sterilized or not new on you. So tattooing can cause a risk of infection, or sometimes it can give you a bad ugly scars if the tattoo reacts, or it can give you a reddish kind of an itchy irritable skin if you react to the tattoo pigments. But tattoo will not give you a cancer. Tanning definitely will give you a cancer, especially if you go to sunbed tanners or artificial tanning. They are very high in UV rays, and those UV rays are really damaging on the skin and increases your chance of getting a skin cancer many folds. So as a dermatologist, we completely advise you to avoid tanning, but tattooing, be very careful and do it from a well reputed safe place. It's okay.
Thank you. Doctor, another question on acne. What are the best treatments of acne, and can birth control pills help treat acne in women? Are there any natural remedies? So we've got three parts of the question. If you can just shortly answer.
Sure. So, acne for the birth control pills, yeah. If you have any hormonal imbalance, which is cause of acne for you, then yes, definitely the birth control pills are one of the options which we do provide, and it works very beautifully for controlling your acne. Not all kind of acne will improve with birth control pills, but especially the hormonal acne will improve. Treatment wise, there is a huge list of treatment, honestly. We start with the creams first. We try and see how bad your acne is, which stage your acne is, why you are having the acne, and then we try and customize acne treatment according to your skin type. So it can include basic creams. Sometimes we give you antibiotics, tablets, and creams also. Or sometimes we can ask you to go for stronger tablets like isotretinoin and more alike. So acne treatment varies. It depends on individual skin. And there was a third part, home remedies. Home remedies, there are so many if you Google, but if you ask me, the simplest way to avoid acne is to put as little product on the face as possible. Don't put too much makeup and avoid very oily, creamy stuff on the face. It will help you in long run to avoid acne also.
Thank you very much, Doctor. Doctor, I'm not a teenager. Why do I still have acne? Is my makeup causing me to break out with acne?
Your makeup could be a reason. We need to see what kind of makeup you put. Sometime it, sometimes it's not only the makeup, but the number of products which you put during your makeup. Like the more numbers of product or the more layers you apply on the skin, it blocks the pores, especially if the products are more oilier or thicker in texture. So makeup is a very common reason for acne, especially in this area, because we all have to do makeup. It could be the reason, or any hormonal imbalances, or sometimes some medication which you might be taking could also be the reason for adult acne.
Thank you. Doctor, can people with darker skin get skin cancer?
Definitely, definitely. So don't think that if you have a dark skin, you won't get a skin cancer. The risk is low, but the risk is there. So yes, people can get, and if you feel any changes, like I mentioned, please come to get evaluated.
Thank you very much. Doctor, I've got a question from Kedar. What is the safe SPF factor to watch out for in sunscreen lotions?
At least SPF 30 and above. It should be at least 30.
At least 30 and above. Great.
And it should be broad spectrum for sure.
All right, thank you. I have tiny boils in my palm and soles. They are itchy and painful. What can I do to reduce them?
It sounds like allergy to me. Sometime you can have allergies to stuff touching your skin, which could be your soaps, which could be the fabric of your shoes. Sometimes it could be a food allergy also, which can give those small bumps on the fingers and toes, which could be very itchy. So either it's an allergic rash, or it could also be a sign of a fungal infection. So if you have it happening recurrent, not getting better, please come to us. We'll have a look and we'll tell you better.
Thank you very much, Doctor. Doctor, what causes eczema? And
Eczema.
is it contagious?
No, eczema is not contagious at all. Eczema is non-infective, which means that there is no infection usually on a simple eczema, and eczema cannot be transferred by just touching your hand or coming in close contacts. Eczema is not contagious, but eczema can be genetically passed on in generation. Eczema actually is a very broad term. So any kind of itching, redness, rashes on the body can be an eczema. But the most common reason why you have eczema is either you have a very dry skin or maybe you have allergies to something, which can be the reason for most of the eczemas.
Thank you, doctor. The question says, I have dry skin on my face. All right, what products are a good fit for my skin type, and what kind of sunscreen should I use during the summer?
Okay, this is a good point. What kind of sunscreen to be used in summers? The sunscreen should be used in summers and winters alike, even on a cloudy day. So it is a general conception that only when the sun is very harsh or in the summer months you need sunscreen. But we advise you to use sunscreen throughout the year, summer, winters, or cloudy season. If you have a dry skin, then sunscreen which are more creamier in texture or which are more moisturizing can be used. As against people with oily skin or acne prone skin, for whom we say that the sunscreen which is more like gel or more like fluid in texture is better for oily skin. But for dry skin people, a creamy sunscreen is a good one, which has ceramides or maybe even hyaluronic. You can combine with the sunscreen. If you have a dry skin, be careful about the soaps which you are using. Sometimes harsher soaps or too much washing of the face can also lead to you having a dry skin. So wash your face not more than twice in a day. Don't use very hot water to wash your face, and regularly apply moisturizers in the night also before sleeping, which will hydrate your skin better.
Thank you very much, doctor. Doctor, what foods should I avoid to clear my skin, and what type of ingredients and products will upset my skin, and how often should I exfoliate?
Exfoliate, I think.
Exfoliate, I
Okay.
believe, yeah. I'm sorry.
Every food is good. All the food has some good elements in it. But generally, we say the food which you should avoid for a better looking skin is something which has very high glycemic index, which includes food which is very high in sugar and food which are made up of refined flours like those bakery items and sugary stuff. We generally these kind of food item with a high glycemic index will make you age more sooner, which will help you have those lines appear on your face much sooner, and will also might be a reason for acne on your face. So avoid food with high glycemic index, and you should include more fresh vegetables and fresh fruits in your diet because they're very high in antioxidants. They give you natural protection against the sun, and they also helps you long run in delaying your aging of the skin. So include more fresh fruits and vegetables in your diet. Similarly, include more of nuts in your diet because nuts has good fats, which is needed for a healthier skin. So nuts, a handful of nuts every day. Good fresh fruits and vegetables every day is good. Plenty of water definitely needs no mentioning. And you should avoid food with too much of refined flour and high sugar in it.
All right, thank you. Thank you so very much, doctor. Uh, Doctor, is it true that if you're gaining weight, if someone is gaining weight, they may get their skin tone darker?
Not really. Weight gain is not totally responsible for a darker skin, but people who are gaining weight, they might experience darker skin on the neck, the back of the neck mostly, on their underarms, on the thighs, and sometimes it can give you a darker patch here also, because weight gain could be linked to some insulin imbalance in the body. And those insulin imbalances are responsible for giving you a thick, leathery texture or a darker appearance of the skin on the body folds. But generalized skin darkness should not be related to weight gain.
Right. Thank you very much, doctor. I've got a question here. Ms. Lima is asking, is physical sunscreen better than chemical sunscreen?
Yes and no. Physical sunscreen are good for people who have sensitive skin because they have least amount of chemical in them. Physical sunscreen is good for kids, especially for people less than 6 months old. The babies less than 6 months old. We never advise them to go for a regular sunscreen, but physical sunscreens are okay for them. So physical sunscreen is basically something which is having less chemical, but it gives you a whitish, a look or a whitish hue on the skin when you use it. So sometimes people don't like the appearance when they use a physical sunscreen. So for general use, if you're not allergic to sunscreen products, you can use a regular sunscreen. It gives you a more cosmetic appeal. But people with sensitive skin and for kids, it is more advisable to go for physical sunblock. Physical sunblock are more protective than chemical alone.
Right, thank you very much, Doctor. Tina D'Souza is asking, how can we prevent signs of aging?
To prevent sign of aging, first of all, we need to avoid sun. We use good sun protection, that's first, because the UV rays are the most important reason for premature aging on the skin. Second reason, which is very common, especially in Dubai, is dry skin. People with dry skin tends to get wrinkled much more easily than people who have oily skin. Especially in Dubai, we are always in AC environment. The Dubai weather is more dry. So you need to apply good moisturizers regularly to avoid dehydration of the skin. Also, after a particular age, like maybe around 30s or mid 30s, you should include stuff like alpha hydroxy acids or retinoic acids in your moisturizers, which are good and effective treatment to avoid early aging. So, for avoiding premature aging, moisturizer very important, sunscreen very important. You can combine stuff like AHs and retinoic, but the most important thing is you should sleep well and you should rest your skin and body, because stress and lack of sleep also are a reason of premature aging of the skin.
Thank you very much, Doctor. Doctor, a very important question as we are living in UAE. Uh, I'll ask two questions together so that you can answer them. One question comes in, I had a lot of hair fall. I'm worried about this. I think it's 2 weeks now. How to gain back my lost hair? But when you talk about lost hair, or when you talk about hair fall, doctor, this has been normal in UAE. What is the reason for that, doctor? Specifically for people who are living in this part of the world, and how we can avoid this?
Sure. Yeah, you are very right, Mr. Fahad. This is very, very, very common complaint in UAE. Hair fall it could be because of so many different reasons. First and foremost, the most important reason for hair fall could be a dietary deficiency. Generally, we say that people who have low hemoglobin, low iron, or people who have any thyroid imbalances, or if you have low vitamin D, low zinc in your body, can be the reason for hair fall. So generally, whenever we come across people with hair fall, we should get these things tested, because these deficiencies can be easily reversed and can help tremendously in stopping the hair fall. Some hair fall could be because of the treatments which we do here in salons and parlors. Too much of a harsh treatment or too much regular chemical treatments on the hair also damages the hair. They make the hair dry and brittle, and the brittle hair is more easy to fall and break off and gives you an appearance of a hair fall. Dry hair could be the reason for the hair fall also, because the weather here is very dry. The water is a bit harsher here, so it damages your hair shafts and it chaps and breaks much more easily. Sometimes it could be the genetic reason also, because some people have a family history of, hair fall or getting bolder. So sometimes those things kicks in a bit earlier in some age groups, and in them they can slowly experience some general thinning of the hair or balding of the hair, which could have a genetic lineages. Sometimes people in Dubai, they're always far away from their home, busy in their work schedule, don't sleep on time, don't eat proper food. So again, stress, lack of sleep, and all these things can also be the reason for hair fall. So mostly we say that a balanced diet is very, very important for hair fall. Second, if you feel that you are having a good balanced diet, you are resting, you're sleeping properly, your hair is not that dry and damaged, but you're still having hair fall, it's always advisable to seek our help. We might look for any deficiency if there is, any genetic problem if there is, and then we can fix it up for you.
Thank you very much, Doctor. Thanks a lot for the detailed information on that question. Doctor, another question, pardon me for pronouncing it wrong. What all are the causes of scabies?
Scabies. Scabies. Okay. Scabies is an infection which only transfers from one person to the other person through a very close contact, or by sharing the towels, sharing clothes, sharing beds, sharing the pillow covers. So basically, a very close contact with a person already infected with scabies can increase your chances of having scabies. And especially people in India and Pakistan and Bangladesh, these areas are very endemic for scabies, which means the scabies is very high in these countries. So whenever a person visits you from these countries, or you have spent some time there and you have recently come here and then you experience itching, it could be a sign of scabies. And maybe if you could come to a dermatologist, they can evaluate your skin and help you know whether it is a scabies or not. But it is a disease of close contact.
All right. Thank you. Thank you very much, Doctor. Doctor, another question. I have small and tiny blisters on my feet, and it itches and most often.
It could be allergy. It could be fungal infection. So just by the itching and a small blister, it's difficult for me to tell you exactly what you might be dealing with. But it could be itchy. Try and moisturize your skin well. Try and wear socks with your shoes and see if it gets better. If not, then maybe you need to see a dermatologist to evaluate better.
Thank you, Doctor. Doctor, as you're moving towards the end of the session, I've got a couple of questions only that I want you to answer. Doctor, what is the difference in socks, which has, there's something we call towel socks, and then there's something that normally we wear socks. Is there any difference in that? Should we wear, which one should we wear?
The one which usually is called a towel socks or a sports socks are better, because they are made up of pure cotton and they can absorb your sweat very easily, and they are not troublesome on your skin. They are not like allergy producing on your skin. So towel socks or sports socks are definitely better. The other kind of socks, which are normally polyester or mixed fabric socks, one, they don't absorb the sweat so well, so it could increase the chances of you getting a fungal infection or other kind of itches on your soles. Second, sometimes it is not very agreeable to your skin type and could be the reason for constant itch on your foot also, because the fabric is not very suitable for your skin. So if given a choice, you should go for a sports socks or a towel socks.
Thank you so very much, Doctor. Dr. Arpita, you've answered a lot of questions. I'm sure people who are watching at this time and people who will be watching it later would be definitely getting a lot of benefit out of this session. Just wanted to tell Doctor, what would be the take-home message from your side?
The take-home message from my side is, one, moisturize your skin very well. Second, always take care of sun protection. It is the most underestimated thing for skin care. And don't only trust your sunscreens. Please wear caps. Please carry an umbrella. Please wear a scarf and take good sun protection wherever possible. If you have any doubts about your skin rashes, don't keep on trying the home remedies. Please come to us, because the earlier we see your rash, it is more amenable to treatments and earlier cured. So don't sit at home using home remedies. Come to us whenever you feel that you need our help. And sleep well, eat well, and be happy, because all those things show on your skin.
Great, thank you. Thank you very much, Doctor. Sleep well, eat well. That definitely shows on your skin. That's absolutely correct. I would like to tell our audience before we leave the session, you can always book an appointment with Dr. Arpita if you have any concerns that you feel that you should see the doctor. She's currently practicing in Prime Medical Center, Burjaman. You can see the number of the contact center at the bottom of the screen. There is 047070999. You can always book an appointment as per her schedule, or you can use the download, or you can download the Prime Health app from Android or your iOS systems, and you can book an appointment as per the availability of the schedule. Please do give us feedback. That is very, very important. Do follow us on Facebook page Prime Health. If you're watching from YouTube, do subscribe our channel also. And your feedback is highly recommended. That would be really very important to all of us. Once again, if you have any concern, you can always send an email to us at myprime@primehealth.ae. Dr. Arpita and myself will be taking off. Thank you so very much. Prime is all about personalized care. Personally, take care of your skin. That is a very important part. As I said at the beginning, that it is the part that is shown to everyone. As doctor said, eat healthy and protect yourself. Thank you very much. It's the month of skin cancer awareness. Spread the awareness to others also. What we have learned today. Thank you. Take care. Bye bye.
Thank you.